I talked recently to, off the record, to an obesity doctor at Harvard, and she said, if I could snap my fingers, I would cure obesity. 80% of medical schools, even to this day, doctors graduate without being required to take one nutrition class. There's been 50,000 nutrition studies in the last 2 years, almost overwhelmingly funded by food companies. The only goal is to confuse people.
Yeah. I think the most powerful thing you can do is ask questions and
Right.
get curious about yourself, and then take responsibility. Calley Means, you are the guy when it comes to understanding what the healthcare industry is doing, big pharma, incentives that are in place politically, how the money is used, what happens when corporations use marketing tactics to confuse consumers. The list goes on. So I want to start with your background, because you're very qualified to talk about all of this stuff, but you've had quite the journey.
Yeah, I grew up in Washington, D.C., and I was just the typical young Republican, on the straight and narrow. I worked at the Heritage Foundation, which is the big think tank. I worked for President Bush. I went to Stanford and was the kind of tool, the conservative, just saying the right things. I was defending big American corporations, Pharma, and the healthcare industry, and went and worked in politics, and then inevitably found myself sitting across the table from the two biggest spenders in DC, food and pharma, and didn't think much of it. I mean, this is just what you do. If you're interested in public affairs, public policy, when you're done with the campaigns, you're inevitably working for pharma companies. I was on the McCain campaign after college in 2008 and sitting with the folks in the Obama campaign. And in retrospect, this is horrifying, but it just is so normalized. But back in 2009, 2010, 2011, opioids, it was a big debate. Opioids were coming on the scene, and it was the task was normalizing and making sure there weren't restrictions on opioids. So as a junior person, I was given a list of professors and contacted professors and created a donation strategy, tens of millions of dollars from the opioid makers to give to professors at leading universities. Wow. And in 2011, and this kind of explains how the sausage is made and how that money actually impacts what happens. The NIH put together a blue ribbon panel to create guidelines on opioids as there was some more scrutiny. And the dean of Stanford Med School at the time, Philip Pisa, was put on the board, and he picked it. So when you have the NIH or FDA, do drug guidelines, drug approvals even, it's not bureaucrats there usually. It's usually a blue ribbon panel. And who better than the dean of Stanford Med School and the folks he's appointed? 95% of the people he appointed were paid for by our donation strategy, either direct consulting payments or research grants, which is the lifeblood of their industry.
So what does that mean if they're paid for?
They receive direct contributions from opioid makers.
And then how does that affect the job that they do?
You got to ask yourself that. So they say, obviously these consulting payments or the millions of dollars, the dean of Stanford Med School that I mentioned was a pain specialist. And he, the year before, received a $3 million grant to do research, which is the lifeblood of the industry. And him and many others received direct, just contributions, consulting arrangements. So you just have to ask yourself, when you're looking at that study and it says, the financial contributions don't impact our judgment, or when you're just a human being who has, 2 homes and a couple kids going to private school, when you ask whether they're what pays their bills, their consulting arrangements, when you ask whether that doesn't decide what research or what their potential findings are, or where they decide to focus, when you can design a peer-reviewed study to really say anything, I feel like you're really asking the American people to just suspend disbelief. I mean, pharmaceutical companies are the lifeblood, are the bulk of scientific funding in the United States. And then when it comes to nutrition research and, the other industry, obviously we'll talk about is food companies spend 11 times more on nutrition research than the NIH. So just foundation, I think you hit on an important point. It's like, are these companies spending billions of dollars? Let's just take the universities in direct funding of scientific research because large food companies and pharmaceutical companies are interested in unbiased scholarship? No. So that's able to buy off. Back then it's the opioids. 95% of the folks had received a direct contribution from an opioid maker. They ended up having very relaxed guidelines, and now with the opioid crisis, over 90% of people that die of a overdose from illicit heroin started with a legal prescription. So, so the opioid crisis, really the root of it, the trunk of it is legal prescriptions of opioids, and then people go out and have to buy it illicitly when that's cut off. And then today, you know, you can get into ozempic and what's going to be probably the most successful drug in American history. But the approvals of fast tracking ozempics, it's on track to be approved for kids after just a 68-week study. So 68 weeks, it's going to be a lifetime treatment for kids. All the folks at the FDA and these panels that are fast tracking that are obesity researchers that are almost universally on the payroll, literally getting direct payments from the drug makers. So that was kind of the job. It's like, who are the key decision makers, you know, that pull the levers of power, and how can we get money to them?
Okay, I want to start with obesity because it is rampant.
Sure.
And we have the drug companies that are funding research that we can't really rely on. And then we have the nutrition funding from the food companies. So can you paint a picture for us of how this all works and how we're basically being fooled or, you know, confused by the language and the marketing tactics and all of this? Because we know we're not healthy. You know, and the American people are fully aware of what's going on, yet we're being incentivized to lean on big pharma and get prescriptions for Ozempic instead of actually working on our health. And it's not just obesity. Look at mental health. I think this is the most depressed and anxious I've ever seen people be, you know? So let's start with obesity, and then I want to move over to the mental health stuff too.
Definitely want to talk about mental health, but let's start at the highest level, because the key point is that obesity, it's actually incorrect to isolate that as really even the problem in and of itself. Obesity is a representation of something larger happening. So right now, let's take mental health, let's take obesity, let's take skyrocketing diabetes, let's take heart disease, let's take the fact that autoimmune diseases are exploding, let's take the fact that 20% of teens now have fatty liver disease, allergies, everything is going up. Rates of cancer are exploding. So everything is going up at the same time. And I think obesity is representative of the biggest lie right now, I think in the world, which is that all these things are isolated silos. So my sister was a physician, has had a big impact on me. And when she graduated from Stanford Med School, she had to choose between one of 42 specialties. So doctors have to, when they're graduating, when they're 25 on average, have to choose one specialty to devote the rest of their life to. That's how medicine has been constructed, through some bad incentives. And she chose head and neck, so she was about 3 square inches of the body. And then once you're done with that, you do a fellowship. So, her attending did a fellowship, and he was responsible for 1 millimeter of the face. And that's where he focused his entire life. And that's how you rise up in medicine. And we've siloed, if you have depression, obesity, heart disease, diabetes, which a lot of people do, a lot of folks are on all of these pills and on this treadmill, you're going to 5 different doctors. So the key goal of medicine in the past 50 years is, after World War II, like, we had these miracles. We had acute issues. We had, childbirth was very complicated. We created surgical procedures, antibiotics that would kill you right away. We created solves for things that would kill you right away. And we took that trust and we're like, how can we create recurring revenue where we can silo diseases in different states and give people pills to manage conditions for life? So what's happening, and what I think is really important about this obesity situation, is that the obesity represents the underlying metabolic dysfunction that's driving everything. And working with pharma companies, it's really, really a targeted strategy to aggressively isolate different conditions and make the American people think. Literally, the American Diabetes Association said that if you take your diabetes medication, you do not need to worry about what you eat. So
that was said?
That was said by the American Diabetes Association. They took that back in 2018. But like that, like, let's just take that, right? And this all ties to obesity, but I think the point is it's all multifaceted. So I, working for Coke early on, we directed money to the American Diabetes Association. They take millions of dollars from Coke. They're majority funded by Pharma that makes money as more people get diabetes. So they have publicly said until 2018, their standard of care. Now, these folks set the guidelines for diabetes doctors in the United States. You can be reprimanded if you go against them. They have said that as long as you take your drugs, you can eat whatever you want. But think about that. You take your metformin that lowers your blood glucose slightly. You're feeding your body with processed inflammatory food, basically told to continue to be sedentary. It doesn't matter. Your cells, it's just common sense. Your cells are malfunctioning and your body is being fueled by crap that will lead to other issues, which is why 98% of people with diabetes have at least 2 other conditions, right? It's the underpinning, it's all connected. But literally a doctor from Harvard, ones I talk to, can't even articulate, how diabetes is related, how blood sugar regulation is. They don't know.
A doctor from Harvard cannot articulate this to anyone?
No. My sister, Calley Means, who's also on the warpath here, was the star of the family. I was doing politics, but she was top of her class at Stanford at graduation. My mom was like, I didn't know there were all these award ceremonies. and then she went to med school at Stanford and was top of her class and was a head and neck surgeon, crushing it. So 13 years of training. And she had an out-of-body experience. And again, good credentials. She was, that's a whole nother story about our family trauma, probably trying to just rise up the ladder, and that was kind of the track we were on, like what niches can we get on the ladder? But she had this out-of-body experience where she was doing surgery, so head and neck, so sinus inflammation all day. She's doing 3 a day. And she looked down at the patient incapacitated underneath, she was cutting it literally open their sinuses and surgically taking out signs of inflammation. It was so bad. She realized that patient had been under a knife 6 months before. And then she realized she had no idea why that inflammation is occurring. And she had done 500 surgeries on that. And so never even thought to ask,
why is this happening?
What is causing the inflammation? And every surgery she was doing was somehow tied to inflammation. And then she pulled it back a little more, and Stanford Med School, more than 50% of their funding comes from pharma in some way. From research grants, it somehow touches pharma. And at 80% of medical schools, even to this day, doctors graduate without being required to take one nutrition class, from Harvard, Stanford, on down. So there's no evil people here, but absolutely, you have a standard doctor and endocrinologist from who does diabetes from Harvard or Stanford. Does not understand the interconnectivity of how diabetes literally just is an arbitrary marker of blood sugar dysregulation. 93% of the country's metabolic dysfunctional has some bad biomarker for that, and it's really the underpinning of a lot of other conditions. The biggest lie that we have been systematically told is that the reason we're getting sicker, fatter, more depressed, more infertile, all at the same time, everything going up all at once, are different things. Right? And we've also been told that it's complicated. The goal of companies is to overcomplicate the issue. There's been 50,000 nutrition studies in the last 2 years, almost overwhelmingly funded by food companies. The only goal is to confuse people.
You know what's crazy? I had no idea. I mean, I guess it makes sense. We send articles to each other a lot.
Right.
I had no idea that people were looking into studies this much. But I guess you're right, that the study comes out, the article gets published, so there's also the role of media in this. But what fascinates me and what gives me hope here, one, there's people like you that are out there. There's also, functional medicine doctors and people like Carnivore MD who questions everything. And it's sort of waking people up. And because we do have social media and we do have Instagram Reels and TikTok and all of that, the word is getting out there. And I feel like we're in a different era because of that. Two, I feel like politically, and I know we're divided in a way that we haven't seen in years, but it's been this way for a while. We are so divided that these issues are starting to come up, and not in the best way, because of course people are just fighting over body positivity and all of this bullshit, which if you just peel back the political layers for 1 second, you'll realize we all care about the same thing: being healthy and happy. Being healthy and happy. Those are things everybody on either side wants.
That's it.
So it's like, okay, if you just peel back the political bullshit, let's figure out what the issue is. Let's pay attention to that. We're in this fight together. It's not a partisan issue.
It's just so simple in a way, but like if you just look at the economy. Everyone talks about the economy. That's the most important issue according to the polls. It's like, what is the economy? The atomic inputs, the basic inputs of the economy are people. And you systematically have a bunch of people in this economy in America that are just not feeling good. They're just like really like, we're almost like through a public policy are making them feel shitty. Like if you are eating crappy food and sedentary and get low sunlight, right, and have constant chronic stress triggers, which we almost like design to like attack kids and ourselves, and have dysregulated sleep. We're sleeping 2 hours less than we did 100 years ago, and our society is almost designed for that. It's just like, you're not going to be at your best. And it's almost like this bizarre public policy we have to almost incentivize, the inputs that lead to unhappy, inevitably, people that aren't like at their most productive, at their most best. It's like the most important issue, and it's actually like kind of simple in a way to me. Like the cause is simple. Like we're the only animal in the world that has systematic like obesity, that has systematic depression. Like they do these tests, like a wolf in the wild, like they have a way, they think, to like do tests of like depression among animals, like has almost zero rate of depression, has like a 1% cancer rate, and has like a 1% like obesity rate. A dog we've domesticated has like a 70% depression rate. Dogs are like chronically depressed, and then like 50% obesity rate, 50% cancer rate. So it's like when you put an animal like in a sedentary environment, give them shitty processed food, it's like what we're basically doing to kids and ourselves. It's just like, this is what happens, and it is new. So yeah, I think it's the most important issue in the world. I think, to your point, there is like a very hopeful message. Like, I think like pace of change is like happening right now so fast. It's like, I don't think we understand where we are on this exponential curve of how much shit is happening. I mean, obviously, if you look at life expectancy, and then it's been doubled in the past 100 years. Again, I think that's largely from acute, antibiotics and some sanitary measures and some emergency surgical procedures that happened before 1960. But like, if you look at the past 100 years, like we've done a lot of great things. We've lost our way. It's created the largest industry in the country, healthcare, and it's been totally co-opted, based on incentive measures that make more money when more people are sick, which is what's going to happen if those are the incentives for the country's largest industry. But it's like, in a way, it's like, I think what's led our system to like this great progress, when you zoom out a little bit, is happening now, which is that this isn't happening in China, where people are having like the conversations you're enabling, and that's happening on Twitter right now with the world's richest person basically just opening the floodgates and letting people be adults and actually just like get to the truth.
Yeah, and not shutting down. Yeah, shutting down curiosity and conversation, and it also increases tolerance. I think that's a huge problem that people are not tolerant. They're quick to react. They're not incentivized to listen. They just take one soundbite and they attack, because they've been programmed to react to certain triggers. You know what I mean? The issues that we've been programmed to react to are all political. You know who does a really good job at explaining the way everything has been working the past few years? I haven't finished his book, but Tim Urban.
Oh, he's amazing.
He's amazing. He is so good at explaining how the world works and breaking it down that, I highly recommend his book.
Oh, it's incredible. I've started it, yeah.
Yeah.
And listened to a lot of his podcasts.
Yeah.
Really thoughtful.
And so it's people like this, and he's, he's one of Elon's favorite writers. Elon brought him into Tesla to talk to his employees, and like, I think that's pretty incredible, because he's not telling people what to think, he's teaching them how to think. And that's really important.
Yeah, not to get too high in this soapbox here, or sound like
it's okay,
making
get
a
high
political speech, but but it's like the foundation of our system is like that if you kind of get ordinary people and give them free speech, and allow them to like not have somebody arbiter what truth is, but have them kind of figure it out. That works really well. I mean, I think that was one of the best. It was a radical idea, and it's like an idea only past couple hundred years. And I just think, it's not inevitable. Like this ability to really have like radical free speech and have public squares where people are able like for all of human history, that's been like totally like pushed against. And like, I think what we have right now is a corporate co-option of basically taken over through money, like the hall monitors, and created this Orwellian world where like well-meaning people on the coast are convinced that they're supporting like black people by saying that they shouldn't have police in their communities, or like supporting kids by not questioning pharmaceutical companies at all, or there's just these Orwellian little boxes we're in where it's like literally like we are like shamed. Parents are shamed in this country for like literally asking a question about like a pharmaceutical product or something. It's just like it's getting people in these boxes, almost like arguing against their interests, and then the mechanisms of like media and government and like frankly universities, frankly organizations that are paid by industries to enforce their agenda are like monitoring this conversation that's unequivocally like hurting us. Like we're not getting healthier in the terms of health. Like how is how are universities and the media like enforcing like a pharmaceutical agenda with what the stats of what's happening now, with 30% of kids getting prediabetes right now, and 20% having fatty liver, with life expectancy actually going down for the most sustained period well before COVID since 1860. It's like we have like all of these like a completely failed system right now, and this effort to kind of silence. So yeah, I mean, I think I've said this, but podcasts and what you're doing and what's happening on Twitter and what the world's richest person is doing, and these lights are sparking, I think, some courage among people. And the one thing I just maybe push on a little bit is like, I don't know if like the average American is quick to like, I think the average American does like know what's going on. I think they have a sense that like something is wrong. And I think, when we talk about how everyone's so hyper partisan, hyper quick, I think that's almost like a narrative that's promoted by special interests, like the body positivity thing. It recently came out that that Nestle and other processed food companies were paying millions of dollars to body positivity influencers on TikTok who were ranting anyone who talked about metabolic health or obesity, calling them racist. So you actually had this you've had this big movement where there's been viral TikToks for people saying it's actually racist because people of color are disproportionately obese to weigh a patient at the doctor's office. And it's racist to talk about weight now and it's healthy in any size. And that money is tied to literally those influencers being funded by food companies.
That is insane.
So just like with Coke 10 years ago, I've talked about how we paid, Coke paid in the NAACP and the Hispanic Federation, the two largest civil rights groups that have done great work throughout American history. They accepted millions of dollars from Coke. And literally said, from the top of those organizations, that not government funding Coke on food stamps, that literally stopping the funding of diabetes water from the government on a nutrition program for low-income folks, that stopping that would be racist. So this debate. So I kind of feel like the environment we're in, where it's like seems like so high risk, and everyone's on a hair trigger, and you're going to be called racist or sexist or whatever, for even like trying to actually ask a question to help lower income kids. It's like I think that's actually like from the top down to much greater than we do.
Yeah. I think the most powerful thing you can do is ask questions and get curious about yourself, and then take responsibility. I mean, we talked about this earlier, but a lot of people don't realize how they're being indoctrinated to react to a system that profits these organizations and big pharma and these big, the big corporations that are funding all of these studies. And I think part of it is laziness. And I'll tell you why I say that. Because I grew up in a household where my mom, we weren't allowed to have seed oils since I was like 10. Oh. Because my mom was obsessed with a guy who she would always get advice from named Ray Peat.
Okay.
I don't know if you've ever heard of him. But yeah, do you know the account Carnivore Aurelius?
Of course.
So all of his stuff stems from this guy, Ray Peat. He was the guy that my mom would like follow all of his
Wow.
stuff. So she knew no seed oils in the house, only cooked with coconut oil, butter, beef tallow. That was it. And I always thought my mom was a little crazy. I'm like, this is a little much.
Right.
And then it became popular, and I was like, whoa, you were right. But my other friends, because if I ever felt depressed, she'd be like, go take a walk. I'm not
Right.
taking you to a doctor right now. But, I've had friends over the years who, look, a lot of people are depressed. A lot of people feel anxious. It's a very common feeling. It's a very common reaction to life. But I would talk to them about like how they're handling it. And I can't even tell you one time, I actually will find the prescription in my phone and show it to you. I'll text it to you, but showed me a prescription, and it was like same pad. It was like Lexapro, Adderall, Klonopin,
Right.
Abilify, one other thing, and I'm like, what are you taking all this for? And she's like, no, I need it because this one helps me sleep, and this one helps me do this, and this one helps with my ADHD. And I was just thinking to myself, like, God, I swear if you just change your lifestyle, you probably wouldn't need most of this. You probably wouldn't need most of this.
So much to unpack there. I think you're hitting on that story with a question I think a lot of people are struggling with. Is like, this clearly isn't a great treadmill we're on, right? It's clearly like something's off there. It's like all those prescriptions you mentioned. The second you go off any of those drugs, the problem is coming back. And I question whether some of those drugs, even help the problem to begin with. There's some questionable research. You're on this treadmill where it's like, obviously just the incentives are fucked because, you're a psychologist. You need to continue to go back to them. It gives revenue to the hospital. It gives revenue to the drug makers. And then you never, the other metabolic issues, statins or whatever drug for chronic conditions, you have to go back to cardiologists. You have to go back to the endocrinologist. It's like, it's a really broken incentive structure. And obviously patients aren't getting better. Those folks aren't going to get better until they learn to like look at the sunlight, manage their stress, these things we don't teach kids to do, meditate, run. I mean, it is absolutely astounding, both the research and just all of our, experience with just like, we're animals, like moving your body. If you keep an animal in a cage and they're sedentary and they eat shit, it's like they're gonna go crazy immediately.
Solitary confinement is a punishment.
So my one question, interesting is that it's like who's culpable and what are the motivations here? And it's like, I go back and forth on this because I think we really do have like people trapped in a tough system, and I really don't. They're not evil. We all know doctors. We all know folks that work at food companies, work at pharma companies. I do put a little bit more than most on people in the system. One interesting statistic is doctors have the highest rate of suicide of any profession in the country.
Why is that?
Well, I don't think it's because they're working hard. I mean, there's missionaries, out there, working more hours than doctors who aren't systematically committing suicide in order of magnitude at a bigger rate than other industries. I think you have an interesting dynamic where doctors do know that there's something really wrong, and they're actually, I believe, actively doing harm. They know that their patients aren't getting better, and I think the reason there's such a high suicide rate is because, and the New York Times actually did an article about this and basically hit on this. They likened what doctors are facing to soldiers who get in the army for the right reasons and then end up being forced by their superiors to commit war crimes. There's actually a psychological condition that lead those soldiers to have high rates of suicide because it's this idea that they're getting in the game for the right reasons. I mean, being a doctor is really hard. I mean, it's kind of this tragic situation where the United States is like this beacon for literally the smartest people in the world to come here and study to be doctors and in medicine. And there's easier ways to make money than going through the residency and the grueling process. So these are mission-driven people, but inevitably, right, you get into a situation where nobody's getting better and you're just on this treadmill and prescribing things. And then your financial incentives are not to have a kid, be metabolically healthy and to go outside and exercise because that kid's not going to be in the office. I talked recently off the record to an obesity doctor at Harvard, and she said, if I could snap my fingers, I would cure obesity. I did not get into this game, to profit from kids being obese. But the fact of the matter is that we just built a large new obesity clinic. I helped hire 20 new doctors for this center. There's loans for this center, and they're underwritten by assumptions of increased patients. And if people stop getting obese and the trend lines don't keep going up, we're going to have to fire the team. The building will go, the loan will default. Every city in the country has a gleaming new pediatric center, the largest buildings, the most beautiful building. So you just get in this treadmill. And I think it's all plausible deniability for everyone in the system. Like, oh, I'm helping obese people. I'm at this new 20-floor pediatric cardiology center. I'm helping kids who have, but they have plausible deniability and aren't asking why it's all happening. And I do, who's going to stand up? You really have just this moral crisis where it would destroy the whole system. It would short-term destroy the economy. I mean, healthcare is the largest industry in the country. It would be very disruptive.
It would destroy the economy if if we became healthier.
It would.
Yeah.
I mean, it's the largest and fastest growing industry in the country. I mean, you have J.P. Morgan issuing a report. It's so funny. They issue a report and they are just absolutely gleeful about Ozempic being the most prescribed drug and most profitable drug in history. And the reports, and this is dollars and cents. This is where people are putting their money. It has, and we all say Ozempic, if it's prescribed widely, is going to lower obesity. For the next 10 years, 20 years, in the financial models, it has obesity going up. Why is that? Why are the people actually putting billions of dollars on the line actually projecting that obesity is only going to go up?
Why are they?
Because there's never been a chronic disease pharmaceutical product in American history that has lowered the condition that it's supposed to treat. The more statins that have been prescribed, the more heart disease goes up. The more SSRIs that are prescribed, the more depression and suicide goes up. The more metformin's prescribed, the more diabetes goes up. We spend 10% of your growth in cancer spending $250 billion on cancer care. Cancer rates are exploding. Every disease we spend money on actually goes up. You can't even make this up, right? But like think about it. Like statins came on the scene, 20 plus years ago, widely prescribed, widely recommended. Heart disease has only exploded. It's only exploded. The reason is we have a moral hazard that's obvious, but nobody in medicine understands this. We have a moral hazard that just goes back to what we talked about at the beginning, that if you are given Ozempic, and just to be clear, we're in the belly of the beast here in LA, and I'm sure we both have friends, who use it. I really have I'm a libertarian. Like I think drugs, give the people the information, use them. I have no problem with people paying it out of pocket.
You've seen. I even interviewed a doctor who prescribes Ozempic freely.
Yeah, and I really don't have if his patients are paying out of pocket for the most part, it's okay. I think I personally think the research it's not going to be a thing in 5 years because there's very alarming things on cancer. There's alarming things on destroying muscle mass. There's obviously if you go off it, you gain the weight back.
You think the risks are too high for Ozempic to last?
Well, I think just any common sense person who's seeing this miracle drug, like there's never the miracle pill, and I think just on the merits, there's a host of unsurprising to me concerning things. I mean, the other thing that's coming out is your heart rate. Your average heart rate is 10 beats higher a minute on it. Peter T has just been talking about that. The muscle mass thing is a huge deal. Muscle is the glucose sponge. We talk about blood sugar. Having muscle is really important. And it seems to disproportionately, actually technically make many people fatter because your percentage of body fat to muscle actually goes up. It's actually depletes your muscle. Not necessarily even just because you're not exercising kind of lethargic. It's actually, there might be some mechanisms that hurt muscle mass. There's a black box warning on cancer. So, this miracle drug that you have to stay on forever for the rest of your life, according to the instructions, that basically, essentially, and this is a little flippant, but literally it's essentially like medicalized bulimia that kind of makes you detest food, which it has to have some other metabolic impacts. The metabolic, mechanisms there, we don't even fully understand. So yeah, on the merits, I actually think it's going to be a flash in the pan. That's my opinion. But taking that aside, even if the drug works really well, the core societal question there, and the lesson we're not learning, is that in the U.S., when something is established as a disease, there's no regulation you can do of doctors prescribing that. It's like, I don't know if the Affordable Care Act, there was like even a small tinge of like the government getting in on what doctors can do. It's like, oh, Obama's getting involved, Dr. Obama, we can't have government telling doctors what to do. So there's a wall there. So the second it's approved for government funding, that's the biggest funder of medicine. Doctors have free range to prescribe to 80% of the American people and get government funding for that. And then also in U.S. law, we're the only country in the world where the government, the largest buyer of medicine, can't negotiate. So that's why costs are going up so much.
They cannot negotiate?
No. So in any industry, so in medicine, costs are going up, right? 2 times GDP. It's the fastest growing industry in the country and the largest, and quality is getting worse. In any industry, right, more volume, innovation is lower cost, better quality. The exact opposite's happening in healthcare. We're spending more than any other industry in a growth rate, and results are getting worse. I mean, diseases are skyrocketing, life expectancy is going down. So the government does not have the ability to lower the price. When a pharmaceutical drug goes widely, the price doesn't go down. That doesn't happen. That's never happened ever. It can't happen. There's no negotiating power from the government, which sets prices. That's by law. So the second this is approved, it's the widest patient population of any drug in history. It's 80% of Americans are obese or overweight, and that's who the indicator is for. It can be prescribed to overweight folks. They just have to attest that one intervention failed. They can literally say that their dieting didn't work, and then it's legally available for them for government funding, which is going to be $8,000 to $10,000 per patient per year. So at the minimum. So like that's the problem. And then let's just take a hypothetical 12-year-old, because it's being pushed to be prescribed to 45% of 12-year-olds, because 45% of them are overweight or obese. So and let's like the second that green light is on, it is going to be a all-out assault to get this into the arms, shot in the arms of 50% of U.S. children. I mean, that just demonstrably is obviously what's going to happen. Like, there's no signs that anyone would show restraint there, and there's already this moral kind of PR push on 60 Minutes on down that this is like a moral imperative almost to give to people that are overweight. So the second that happens, right, you put this in, and you literally are telling. So this is literally what the doctors are saying. So on 60 Minutes, and we all seen that, Fatima Stanford, she literally says, throw willpower out the window, food, exercise, throw it out the window. These children are explicitly being told that food and their choice doesn't matter. They're not pairing this with dietary guidance. So you're going to have just an epidemic, like a low-income child. They're going to get Medicaid-funded Ozempic and no help to eat better and no guidance.
You know what, though? I feel like, look, we are very fortunate.
Right.
Both of us. And I feel like, the people that we're around are very, they're successful, they're wealthy, they can afford these things. Mm-hmm. They can afford to take care of themselves in ways that people in lower income households cannot. And that's the problem, because the general population, I mean, what can they afford? Forget just financially, what can they afford? Time-wise, can these parents or these single moms afford to, take walks with their kids or afford to pay for karate classes or whatever it is? It's like, I mean, you have to factor that into. Even when I buy like cage-free, free-range eggs that are organic, it's like, it's $8 versus like the $4 one. It's
a couple pushes on that.
Okay, push.
So one is, and I don't think moms are systematically trying to kill their kids, even lower income moms,
Same.
but that's what's happening.
Right.
So I do think if moms were told that are lower income, that is an existential priority to take more walks with your kids, and your kid, if they have prediabetes, which 30% of teens do, is going to almost certainly die 6 years younger, have a 300% higher rate of committing suicide and being depressed, and statistics on down. Like we're not even telling people that. Like right now, the USDA nutrition guidelines, which, as we talked about at the beginning, 95% of the folks on the nutrition guideline committee are paid for by food and or pharma. They literally say a 2-year-old should have 10% sugar of their added sugar into their diet. It says that is okay according to the government. A 2-year-old which is a farce saying 10% because it's a highly addictive drug. By all definitions, if you do a brain scan, the dopamine is the exact same areas of the brain of taking another illicit drug. So that is what the government is recommending. So I do think there's a top down and bottoms up. I would actually say I don't blame that single mom. Like, I think we have like a mass like capture of the situation where they, as you said, have to defer at some points to some experts. And I do think if the experts said to them, like, try to cut sugar, I mean, this is the biggest issue. Like, there's no bigger issue that the metabolic health of kids, that 40% of high school seniors qualify as having a mental health disorder. I mean, that's all tied to the same thing, that autoimmune conditions are explained to all the statistics we talked about. Like if the government was clear and like said, they don't recommend cigarettes for children. Like there shouldn't be there should be no sugar. Like you can give, it's a free country, but like that should be the aim.
Yeah, it shouldn't be recommended to them.
Yeah, and then on the money thing, this is more top down. I think this is what I'm on a warpath for, really, and I think this is what the 20-year. I mean, we might not be around in 20 years, but like this is the long-term battle. The money is there because we're going to spend $10,000 per patient on Ozempic. So that money's coming from the government. So the lower income kid is going to get, like imminently in a couple months when this is approved, they're going to get so that's coming out of taxpayer money, $10,000. So my point is, if you just have like a screen, like an alien comes down and like, what should we do? Like all these kids are like completely sick. It's clearly this like root cause situation where we incentivize crappy food for them that's addictive, and they're much more sedentary than they were, and not sleeping, and all these. We fix those root cause, and you solve everything, and you improve human capital. Let's take that $10,000, take $2,000 of it. They can go buy organic food for the rest of the year. Or $4,000. I mean, like a fraction of what we're saying to spend on Ozempic. So that's this opportunity cost. You bring that widely, $4 trillion we spend on healthcare. It's like, what if we slant it? It sounds like fluffy, but like you would never design a system where 95% of dollars are waiting there after people get sick to not even cure the reason they're sick, but manage the condition. Everybody my sister did sinus surgery on, they were back under the knife. It was like every single person. It's not curing. Ripping open your face and cutting open the sinus infection and taking out the pus, that because your infections are so bad, doesn't cure anything, right? They're coming back and making a lot of money because Medicare is paying the hospital for that. And Medicare is totally bought off by Pharma because Pharma spends 5 times more on lobbying than the oil industry, and there are 5 lobbyists for every lawmaker. And healthcare is the largest industry in the country, and in in almost 50% of U.S. states, the largest employer is a health system for that member of Congress. So it's like that. That's what I would say on the cost. It's what our companies, kind of what I'm meeting with a lot of members of Congress on, and our company's trying to change. It's like, it sounds so simple, but like you can literally like slant incentives instead of Ozempic. I would just say, should it be Ozempic or food? Like should that mom be given Ozempic for the kid, or should the government say, take 50% of the spending, 25% of the spending, give that mom a card and say, here is free money, but it can be used for these. It's like a prescription. They could give a card that's able to buy organic food. I have nothing against. I don't think Coke should be banned. We should not be funding it though. And then it's like, well, what food do you? Well, start with whole food. Start with food that isn't made in a lab.
Some people don't even know what processed food really means.
Yeah, ultra-processed food is coming up on 70% of our diet. It is basically anything that's been through a factory, anything with a label on it, really.
Anything with a label where you can see the ingredients, that is processed.
Yeah, and there's a couple things, and we talk about the unholy trinity of ingredients, but the foundation of the American diet, if you pick up any food, it's just astounding what American ingenuity can do with these 3 ingredients. But the 3 most popular ingredients in our diet are 3 things that did not exist 100 years ago.
Which are?
So obviously highly processed sugar. So sugar, for all human history, fructose was in fruit. And fruit was pretty rare. And fructose, there's a couple books about this, but you're evolutionarily, when you eat fructose, which is a key form of sugar, it shuts down your body's feeling of satiety. You want to eat more. And they say that was what fruit was kind of weapon, because fruit actually makes you fat if you eat a bunch of it. But if you were, from almost all of human history, saw a big batch of fruit, you were well advised to eat as much as you can, because literally, and this gets to the fasting thing, but like the human body, you can go a long period of time, weeks or even months, without eating. And humans, we think, did actually. So if you saw fruit, you were well advised to stuff. So we've actually, just in the past 100 years, isolated and processed sugar, which is a totally, essentially new invention. And now an American is eating 100 times more sugar than they did 100 years ago. So that is like true. And they're literally taking the right kind of sugar, fructose, high fructose corn syrup, which shuts down your hunger cues. And that's what's given to kids. So when I say weaponize, like that's a big part of it. Like this is a drug. Then we talked a lot about seed oils. You were talking about seed oils. But let's get out of the research. Let's get out of this debate. There's stuff on Twitter. It's just, for me, it's very basic. These products are highly processed and didn't exist 100 years ago. It was actually created by John D. Rockefeller as a byproduct of oil production. And today, soybean oil is the top source of American calories. Like it's the most popular item and the most highest calorie source of a single ingredient in the American diet. So in 100 years, after millions of years of evolution, the top source of our fat, one of the top sources of our calories, it is disgusting how these oils are produced. It is a disgusting artificial byproduct.
How are they produced?
You literally, I mean, these are the canola oil, canola seeds, these are like almost microscopic seeds that are crushed up and then added with a bunch of chemicals to take the oil out. And run. I mean, Google how canola oil is made. Literally blended and extracted this little seeds, the oil from the seeds with carcinogens. It looks like an oil manufacturing process. And
this is contributing to rise in cancer.
Well, again, we're the only animal that has all these problems. So it's like everyone's like, well, where's the study on this? Where's the study? It's like, why the hell? It's like totally the wrong debate. Why does anyone have to produce a study about the top source of American fat being fake, that we're just genetically, biologically not able to? It's like we're already on this, like, well, this part of seed oils. It's like that's a key ingredient going into our bodies that is brand new and really a disgusting process. To have a byproduct from like manufacturing be like more profitable. So there's that, and then highly processed grains. So anything at a store, in any package, you're going to see some kind of refined flour, such as refined flour, refined wheats, things like that. And the refining is to take the fiber off. So this is an invention in the past 100 years, really post World War II. Started with good intentions, but the fiber blunts the glucose impact. So when you eat Cheerios or eat refined flour, it's basically sugar. It's basically a hidden sugar. It basically turns to glucose in the blood, and it has that insulin response and has basically an addictive tendency to it. If you eat a whole grain with fiber, the fiber blunts the glucose impact. The fiber also has a lot of the nutrients, but the fiber rots. So taking the fiber out makes it shelf stable. So that's why we're able to have so many things on the shelves that last for years. Started with good intentions to have more, food security after World War II when we had to feed the world, but it's been co-opted. So we have those three ingredients that, again, it's just like you have scientists on. For me, it's just like, let's just basic. Like these things didn't exist. like they're foreign substances in our body. And my sister, on her path after leaving medicine to discover what was causing that inflammation.
She left medicine because of that out-of-body experience.
Yeah, she abruptly. It was as I said, the whole family was on this. I was on this. I was, going to business school and trying to work for presidents. We were all on this, playing the game. I was defending Pharma.
Yeah.
And she very abruptly quit. After 13 years of training with no plan. She now started a Levels Health, which is I have one on right now. It's a glucose monitor to help you.
My friend wears that.
Yeah. She started that out of her experience, and hundreds of thousands of people are wearing glucose monitors now, and they created an app to help you. When you eat that heart-healthy oatmeal and see your glucose go to diabetic levels like I did, it's like, it basically helps you subvert the fake marketing. But her extrapolation of what was causing those patients inflammation, it's very simple. We always hear about chronic inflammation right now.
Yeah.
Inflammation is a good thing evolutionarily. Like inflammation is when the body like summons forces to attack something foreign in the body. Mm-hmm. Now we are all chronically inflamed because we have foreign substances in our body at all times. We like the main source of our diet is food that our body doesn't recognize. We have environmental toxins. Like that's why our body's in a constant. It's that simple. So our body is turning against ourselves when that usually has always been a very good thing. If something bad was in our body, that's happening for most people at all times. So.
Okay, wow.
Yeah.
I want to get into the role of media for a second
Sure.
because I feel like it's very important.
Yeah.
I was very lucky to have met you through the recommendation of Max Lugavere. We did a Twitter space together. And when I heard you talk, I'm like, this guy is the guy that should be talking about this. And then you're doing the rounds on all the podcasts, and you had been on Tucker Carlson. Why aren't you everywhere? Why aren't people like you everywhere? But we're seeing you pop up on social media and through the podcast circuit. But when it comes to media, you're not there. Mm-hmm. Why is that?
Well, as I said, I started my career in DC, and a lot of friends went into consulting for pharma companies. Some people went more into media stuff, working behind the scenes in media. DC, everyone just disperses out into all these places of the swamp. And I've actually talked to some friends that are producers at the standard places, CNN, NBC, places like that. And you welcome in the Twitter comments anyone to dispute this. This is what I've heard in black and white is, I think, just manifestly obvious. But they have a black and white ban on negative pharma stories. The biggest issue in the world right now is that we're getting sicker, fatter, more depressed, more infertile because of very simple reasons: poison food supply, food that's cheaper and more addictive, by design, and then the biggest industry in the country, as we talked about, is profiting from that. Like that's a big area to investigate. Like all these stuff we're talking about. It's like, again, when you just take it to what people care about, their health and happiness, this is kind of everything. It's the first order issue. I don't think anyone would disagree, right? This is important. The things we're talking about, complete and utter lack of curiosity from the media. COVID deaths were a foodborne illness. Like dying of COVID was foodborne. Like metabolically healthy people, with very few exceptions, largely did not die of COVID, even no matter what your age you are. There's tons of study on that.
Yeah.
100% of media and government, trillions of dollars of publicity was around pushing a pharmaceutical product. There was never a speech from Dr. Fauci or the media or any curiosity about what actually caused people to die of COVID. Why maybe COVID deaths would be related to the increases of every other disease we've talked about, which it is. Why if we don't harden our metabolic health and have a rallying cry for the country, frankly, like RFK just tweeted about, complicated rabbit hole there, but this is the key issue. The inputs of our country, the inputs of our economy, the brains and bodies that determine the reality for every citizen are being systematically fucked, which is causing every condition to get worse. It's it was a golden opportunity, zero curiosity for the media. And not even, just class dispersions on a pharmaceutical product. I'm not reflexively anti-drug, but this is a small part of it. It's just a small part of any chronic issue. And it gets all the airtime. And it's like the media has become hall monitors. Science is really just determined by whether you support pharmaceutical products. That's anti-science. So the fact that our, at least legacy information sources receive over 50% of their funding from pharmaceutical companies, which is just astounding. It's like asking whether the dean of Yale Law School, who receives $3 million a year from pharmaceutical companies, whether that impacts where he conducts research. It's just like when somebody's paying your bills, you know, and there's a wall on coverage. So Fox, I think because of the COVID stuff and breaking ties a little bit with pharmaceuticals is their financial interests are different. And then obviously independent media. I think Joe Rogan on down, the podcast revolution is like a historical book, like, you know, Ben Franklin level like figure. I mean, I really think like actually what's happening with media is astounding because I do think there's an effort to really hall monitor and silence debate from a corporate like media. I mean, I think Elon's right. I think it's right, this idea that Twitter might be his most important project. You know, everyone thought it was kind of frivolous, but the goal of free speech, it's like it's everything. So and it's completely censored on the most important, like not only lack of curiosity from media, but I would say intentional gaslighting about what's really happening.
Give me an example.
I mean, the most stark example is, is the causes and really what the lessons from COVID were. I mean, we had the worst public policy response since World War II. I mean, like of our lifetimes. Like we haven't grappled with that at all.
We haven't, and I think back to the conversation about how politics plays a role in this.
Right.
Instead of coming together and being like, what's happening? What can we do? What are the right policies here? Who's the right person to combat this without any political affiliation on either side? What has become, do you feel like, the fake war that we're fighting instead that's masking the real war path that you're on, for example?
We're distracted. I mean, we're distracted. I mean, there's as I said, it just goes back to rigging institutions of trust to get what you want. This isn't complicated, right? It's like look who's receiving money on the civil rights groups to call people racist. It's all corporate interest to push a certain agenda. Like at the end of the day, look who's calling people sexist. Look who's trying to shut down debate. Look who's hall monitoring. There's always financial interest there. And sitting in a public relations office in DC early in my career, it's like this isn't complicated. It's like civil rights groups. Okay, let's call people racist. Okay, let's pay researchers. Like let's pay researchers off. Let's flood the zone with hundreds of millions of dollars of donations to researchers to say it's anti-science, right? And then you get that document that says what you wanted to say. And then, you know, people that said sugar caused obesity were violently called anti-science in the 1990s.
I didn't know that.
Well, the food pyramid was the gold standard, as we all, you know, the food pyramid in 1992, which, you know, I grew up, which when that came out, carb consumption as a percentage of American diet went up 20% in the next decade. You know, fat, like the most preeminent nutrition document from the government, the food pyramid, which had carbs and, you know, basically sugar at the bottom, and said, you know, basically vegetables and kind of meat, you know, sparingly at the top. And then olive oil was like, no, healthy fats. I mean, that was from the government, and you were anti-science to question that. And it was totally fake. I mean, it's the most violent document I believe in American history.
The food pyramid?
Absolutely. I mean, it for essentially a generation, my generation, that seeded the chronic disease crisis. It literally said carbs should be the preeminent part of the diet, which turned into sugar. It led, you know, kids to be marketed just sugar-filled crap that just didn't have fat. Fat's good. So yeah, I just think that happens, and then yeah. So
yeah. No, that makes sense. When you say Orwellian society, I don't think everyone knows what that means.
Well, the key concept there is making people fearful in using their own judgment, and, you know, making people feel fringe for asking a question, right? So like, I'll give one example of Orwellian, and it also ties into the media. I mean, like, to say that Joe Rogan was enemy number one in 2020, 2021 among the public health establishment is not an exaggeration. I mean, this was a key, like, villain and target of both the media and public health, and the emails are coming out from the NIH with Dr. Fauci, also between the media demanding that they delegitimize him. And this is a podcast host who sits on a microphone, smokes pot, and literally just basically doesn't really even give like really strong opinions. He basically just talks about asking questions, and he has general principles. I mean, literally, I'm like hearing all this vilification in 2020. I will turn on the show. It's like he's talking every day about like looking at the sun and working out, and eating well.
Yeah.
and maybe like that we're off on psychedelics because they make him a more empathetic, compassionate person. It's like that's literally kind of like it's actually like astounding. Like when you really like listen to his show, it's like, and then a lot of the other podcasts that are called misinformation. It's like, it's people that are, folks you have on, you often, it's like not necessarily with the full answer, but asking some questions with good intentions, good vibes. And it's like an onslaught of just like from the head of the NIH to the media to call these people radical, crazy people and gaslight everyone else really from asking questions. So I think what's Orwellian now is no longer our ideas being attacked, but even the act of asking a question is being attacked, and that's kind of hall monitored and enforced. My hall monitor is the word of the day, I guess. But you really have these people with incentives to even attack the question. And historically, when people start even attacking the ability to even ask a question, not the content itself, that's usually a bad sign historically. So that goes to Orwell's book 1984, when thought crimes, and just people were processed for even thinking something in the wrong way, and that's kind of this world that at least the media, I think, is trying to enforce. I mean, it kind of gets into this RFK thing. I don't know. I don't like to go too much into this stuff. Well,
but you know what? I think it's good to go into it because now people are paying attention. And the funny thing about Rogan is like people are losing trust in legacy media so much I think.
Right.
That
No, I agree.
Look at the numbers on Rogan versus MSNBC.
Yeah, and it goes to kind of I heard you pushing on a little bit, which is like, aren't we so divided? Aren't we? Everything's so. Again, I have to think that maybe some of that's just like the echo chamber that's almost like trying to kind of keep people disciplined. You look at the numbers, and I don't know. You get outside of the coast sometimes and talk. People. It's hard to keep people down. I mean, they're kind of thinking for themselves. You see with the numbers with, the most popular.
I think they're learning to. I think that. Sorry to interrupt. I think
please.
They're learning to.
Yeah.
But I think the people that are the loudest on the internet and the people who have, some of the highest numbers are some of the most divisive people we've ever seen. I mean, to call out the right, the left, it's like you and I have not had that conversation, and we don't really need to. You know what I mean? When you start being like the left doesn't like this or the right doesn't like this, you're automatically alienating a large group of people who otherwise would be open to listening to your arguments. Automatically when you do that. So even the way we communicate on the internet is complete bullshit.
Yeah, I agree with that. I kind of see it. I mean, the charitable ways that people the internet has just thousands of people chipping away. I'm trying to chip away at incentives of health, right? And chip in a good energy way. I'm trying, right? And it's just like I just feel like there's a bunch of warriors who, if they're putting good energy out and chipping away and I think me talking about food and pharma incentives is in some ways the same way of somebody talking about education incentives or military industrial.
But you've been there.
Yeah, and I'm trying to contribute, and I just feel like if people can chip away on the internet with good intentions and like chip on their area, and the dots almost, I read people chipping away who have more of an experience with the military industrial complex, which I think is very similar about the incentives to get into more and more and more wars. Like, what happens if we don't have conflict?
Yeah.
I think it's a very similar thing. I'm like, oh wow, there's dots, and I'm reading people. So I don't know. I don't know. It's a complicated thing. One thing I'd say, I think this is, again, I think we need to appreciate even some of the messy stuff. I mean, trans rights, Me Too, Black Lives Matter. Like like we can agree or disagree. I think a lot of these are co-opted by bad interests and misguided. But at an optimistic level, we are processing like an insane amount of shit right now in society. Like it is unprecedented. And then as far as like the left-right divide, like again, this is very messy. But like Trump was basically a Democrat. The orthodoxy of Republicanism, like the Republican Party, he went against like half of it,
Yeah.
like free trade and all this stuff. So it's just, and then like RFK is like, it looks like the most popular politician running for president. And he's running as a Democrat and just blowing up every orthodoxy. So it's really unstable and kind of messy, but you know, you can maybe zoom out and see some positivity that like these tribes are actually maybe diminishing more. I mean, you know, the bear case is people are looking for a savior, looking for, you know,
Always.
a leader, you know, but like we got to channel that in the right guy. I'll say it. I'm glad we have Elon as one of them. You know, I'd rather have him than a lot of other people. He's trying.
Yeah. No, he's definitely trying
he's
on
trying.
that end.
He's trying.
Yeah. I mean, did you see he had RFK on Twitter Spaces?
I did. Yeah.
And everyone's always like, you know, he's so right wing, he's so this, he's so that. Is your mic good?
Yeah, dude. Sorry.
Okay, good.
I'm just playing with them.
Okay. But yeah, I mean, these are all issues that we grapple with. If you were to talk to a mother of a newborn, in maybe not the best financial circumstances, because there are a lot of those,
right?
What advice would you give to them in terms of making sure their kids are healthy, making sure they're receiving proper nutrition, not in accordance with the food pyramid that we, you know, got shoved down our throats, but in accordance with what you know to be healthy? What would you say to them?
Don't trust your doctor.
Really?
Everyone comes on the podcast and says some advice and then says consult your doctor. It is Orwellian. It is just against any analysis of any data to say that you should. It's not to not listen to what they have to say, but really taking much credence in what a doctor says, particularly around children, when it comes to preventing chronic conditions.
Because they're not there to prevent chronic conditions.
When it comes to managing or even managing chronic conditions, like what bizarro world are we living in that a custodian of the medical system should deserve any benefit of the doubt when it comes to giving a mother any type of advice on nutrition or, you know, just general lifestyle. Like if your kid has a infection that's going to kill them, absolutely go to the doctor. If your kid has an acute issue, go to the doctor. Although I'd be a little bit, you know, skeptical if they're trying to jam antibiotics down their throat. But yes, 100%. Like acute issues, life-threatening issues, go to the doctor. Absolutely, just they deserve no respect. They deserve respect is a strong word, but they deserve doubt. And I would just argue, and I'd say to that mom, you look at what you're being told, right? You know, and just not to take this into too many issues, but you know, you're basically being told that you're an anti-science, awful person to even ask a question about 71 shots that are recommended for that kid by the time they're 6. Shots that, by their own advertising, irreparably change the immune system in powerful ways. I think vaccines have been a great innovation, but this enforcement of not even asking a question, the enforcement that you're a bad mom if you ask one question about 71 shots that you're going to give your kids that change their immune system, that's enforced by Pharma that makes hundreds of billions of dollars on this product. And Pharma pays and colludes with the government and the media who they pay to enforce this restriction on speech on that issue, which RFK is bringing up. Like, that's to me, like it's not an anti-vax thing, but I think one thing RFK is resonating on is like, why the fuck can't we ask a question about that?
Yeah, and I want to be very clear on something because what we see on the internet is these issues are being brought up and then people are fighting with each other in the comment section and then giving all of their power to these presidential candidates and being like, if I elect this person, you know, then I'm doing the right thing. But the reality is, the president of the United States is not going to save you, and is not going to make you healthy, and is not going to make you less depressed, and is not going to fight obesity. They're bringing the issue to the table and rallying support because, you know, they've garnered a tribe or support because they're being fearless on an issue. But the reality is, you can take matters into your own hands. And that's, you know, that's something that I really believe in. If you take personal responsibility and you're curious, take politics out of it. I'm so passionate about this, I can't even tell you. I have watched people waste their lives away just fighting with people on the internet or in person about dumb political issues. It's like, look, watch the shows, listen to Rogan, watch Bill Maher, who I think is like pretty fair in terms of who he brings on. Like, there are people out there that are really great, and you can learn a lot from them. And you can learn a lot from paying attention to the presidential race. But after you've done that, take matters into your own hands.
And going to that single mom, there's so many interests to keep her in fear, to keep her doubting herself. I really do think it's a bit of a spiritual crisis that we're in, where it's like that mom has been taken, well, first, just starting with the birth. I mean, we've totally medicalized birth. We've told, you know, and everyone's on their own journey here. And there's absolutely I mean, I am in awe of watching the birth process, and everyone is on their own journey. But it is notable that we have a 37% C-section rate in the country right now. We push folks, we've medicalized birth, you know, told women, basically instruct them that they can't handle kind of what nature, you know, natural process, and get them on a medical train right away. And then, you know, a child is born, and, you know, the American Academy of Pediatrics requires doctors to give moms dietary guidelines to eat processed grains as these rice puffs and different puffs as their first food, which is obviously just insane. You know, and it's just on a pharmaceutical bandwagon, you know. And I just think, like, we've been battered. Now, you know, now if you have a 10-year-old, you know, there's a law in California being pushed that you can't even disagree with your kid about their gender. I mean, I think we're really, with some bad interest, like, attacking the autonomy of, like, parents to, like, exert common sense and ask questions. And I think that, like, even a single mom, it's just like she has probably better intuition than a lot of these unimpressive pharma executives I saw. And, you know, again, like 90% of costs in healthcare, you know, what's crippling kids right now is chronic lifestyle, essentially food-based, metabolic, also exercise and sleep, things like that, conditions. And you are not going to get the answer from the medical system on that. They've lost any benefit of the doubt. And that bottoms-up message is hopefully a little bit empowering. But, you know, I think from the bottoms up, people of all ranges, you know, of different backgrounds and areas and political persuasions are coming to this idea of kind of questioning the system and taking matters in their own hands. I think that's really good. You know, I think obviously, you know, heart goes out to people, you know, that are struggling, you know, in various ways. But, like, I would say, just to be blunt to your question on this thing, it's like your job is to keep that kid healthy, and they are under absolute assault from some very bad interests. And you should do anything you can to try to educate them about seed oils, added sugar, and highly processed grains, which are 3 ingredients that are destroying the human capital of America. You're not going to probably be able to completely restrict your kid from eating that. But, you know, I have a young child, but inevitably he's going to start, you know, finding those ingredients. You can't keep him locked up. But it's like, I think it's educating your kids about addiction, honestly. I think we have an addiction crisis. Of many different things, of social media, of porn, which is a huge part of internet bandwidth, of obviously drugs, alcohol, caffeine. It's like, to me, it's all the same. Adderall with 20% of high school seniors around. It's just like, there's so many things that we're addicted to, and I think food is actually probably the biggest and most consequential. Like, we've weaponized our food with drugs. So that's my framework, is like having a conversation. Like, it's a conversation I'm having with myself right now, you know,
Yeah.
like I like am fiending after some sugar or something, you know, we all, it's like a
Always.
huge thing. I mean, it's just like it's an addiction. I fasted for like 7 days recently because I read this book that somebody did it for like months. And it was like the hardest day was like days 2 and 3. And like, then I wasn't hungry. I actually was having addiction withdrawals, I felt.
Wow.
I think we have an addiction problem in the country.
Okay, on the topic of addiction,
Yeah.
I've heard many times the antidote to addiction is connection. What do you think of that?
I think what at the spiritual, like personal level, what is so motivating to me about this metabolic health message and kind of the mission that I'm on is that like everything is connected. Like I've gotten so much value from like some of the health podcasters talking about the protocols, 12 minutes of cold plunge, 57 minutes of sauna. I was actually in my best friend's wedding in Sweden the other week, and we did a sauna in the countryside. And there's all this research about how the Swedish people are the happiest people in the world because they do 57 minutes of sauna a week. But it's like I was there, and it's like all of his friends, and they're talking about how like they always used to do the saunas
Wait,
together.
the infrared?
No, we were doing a traditional sauna in Sweden. In the countryside.
Okay, because I want an infrared sauna so badly.
We were in a traditional one. There's a debate about that.
Okay.
But it's just like, it kind of clicked for me, and just seeing that lifestyle, how they grew up like in the sauna with friends, with the community, with family, then they jump into the water with the beautiful mountains. It's just like, it's not like hacks. Like there's no like hacks for anything. You have to like the reason the research is so good in Scandinavia about saunas is because they're doing it with the community. They're like practicing healthy lifestyles.
So it is connection.
No, it's everything is connected.
Together, yeah.
Everything is connected. There's no like, you have to have everything in harmony. You have to strive in life to have everything in harmony. It's not finding the dietary hack. It's not finding the networking hack. It's like we need to incentivize and talk about in America, like not siloing all of these issues into, different like diseases and different problems. It's like, I think the mental health and the physical health and all these crises we're siloing in different things are actually all connected. Like, and community and connection is absolutely huge. I mean, I think that is like an arm of the metabolic health lever. I think we should be bending and investing and thinking more about fostering connection, among people, which is really suffering. There's public policy ways, there's cultural ways we can do that, and it's just not where the brain power or incentives go right now. So to me, that's my big goal. It's to take this $4 trillion we spend on healthcare and beat the drum that there actually are, from the top-down public policy solutions, to spend that money better on more walkable communities where people can hang out and meet each other, on incentivizing things that breed community, on incentivizing things that, exercise, food, things like that. It's just like, to me, it's all connected, and there's no hacks, and we need to start realizing that.
I think so too. But on the topic of community, because I think sense of belonging is huge.
Yeah.
And I think about the way I was raised, the way all my friends were raised. I went to private Jewish school my whole life, and then USC. And I had a lot of friends growing up, going to like Catholic school or whatever. These are all little communities that you grow up in. The problem is, are they healthy? And we don't ask ourselves that. And I feel like in a lot of these communities, there's a lot of like punishment or religious rules and stuff that doesn't necessarily need to be enforced. And all of these parents are so scared that they're like, okay, well, religion will save my kid. But a lot of my friends that went to like Orthodox schools, for example, I went to, pretty modern Jewish school, but the ones that went to Orthodox schools where they had to be like completely covered and the men and women were separated, they had so many issues I can't even tell you. Once they got out, they were the most rebellious kids I had ever seen. And we don't talk about that enough. You want to put your kid in a community, is that community healthy? If you are joining a community, is that community healthy? Forget just the community. Is it a healthy community? What is the thing that's bonding you two together? Because if it's like a political tribe or a religious tribe that has an enemy, you're fucked. That's what I think.
That's powerful. That's powerful. I mean, there's so much to unpack there. I think I just keep thinking about kids and how a child is inevitably going to have to face adversity and some trauma. It's the human condition.
Yeah.
And be potentially thrown into suboptimal situations. And it's just like what they're equipped with is like kind of their internal toolkit in their body and brains. And it's just like, I just can't like stress enough like how like like the microbiome, the research on that, and the research on the bacteria in our gut, and how 95% of serotonin is produced there, and it really regulates your contentment. And then what happens, from 0 to 5, really, as all psychology says, and even biology of how the body develops has a huge impact. So if a kid is like eating processed food, is destroying their microbiome, is destroying their serotonin, has dysregulated sleep because of that potentially, and other things, is sedentary. They're just equipped. They're just not at their best. Like it's like small, but their ability to cope and process inevitable, like maybe tough events. It's just this cascading, compounding issue, which I really worry about. I think it gets in a little bit to education and just what we prioritize teaching kids. It's like, and connecting to mental health and like just processing these things. It's like, why in the world are 25% of high schoolers on SSRIs, but we don't teach kids how to meditate?
Oh,
Like not even a blanket like denunciation of SSRIs, but it's just like it's like something like 20. It's like skyrocketing. The amount of you talk to anyone who has a high schooler, it's like they're being pushed heavily, and it's like, but we don't like teach these kids to like regulate their emotions. Like it's crazy.
yeah.
I feel like we're
think
both
about
on those journey, like probably thinking
Calley.
about mindfulness.
I feel like mentally, I'm like exactly where you're at. Where I'm looking at all the institutions and the way we were all raised and how how we've gone wrong as a society. And I think about school all the time, where it's like, what are we really being taught there? We're taught to, I don't know, get fed into the system. I mean, essentially, but what should we really learn? Like if I had a kid right now, I would hope that they were being taught emotional regulation and conflict resolution,
Something
and how
more
to
important.
communicate, and how to be intimate with someone and have trust. Because it's like, look, I'm single. All my friends are single. We're in our early 30s, and like that was not the case a few years ago. I mean, not like 20 years ago.
Yeah.
Things are not evolving in a good way. I feel like we don't have the tools that we need, and the education system isn't giving it to us. No one talks to us about mental health in school. I pay to meditate. I go to a place and I pay to meditate, and it changed my life. No one taught me that in school. Everything that I learned, I had to learn on my own through books and authors and podcasts. And so I feel like we're at a point in society where we're really lucky because we do have these resources. And honestly, yes, social media can be really bad, but it's also where I found you and where I found a lot of other people that changed my life. So I do think stuff like this should be taught in schools, and I don't know why someone hasn't started a private school that has a curriculum that is geared towards these things.
It's a huge issue. It's the baseline thing we should be worried about as a society, and I link it to health because we need to equip kids, it's the highest leverage point, to be ready to deal with the inevitable trauma and onslaught against their brains. I mean, it's a lot. I wouldn't want to go back 100 years ago, but we have just an onslaught of things that are triggering a child or an adult's dopamine levels and tension right now. And again, I love social media is great. Like I love all the entertainment options we have. But I think like one of the biggest skills as a human, one of the most important skills is just being able to like modulate your attention. And just kind of like as meditation and mindfulness talks about, to kind of separate yourself from the constant like clutter in your mind that's being totally hijacked by a bunch of different industries, both from an attention standpoint and a dopamine standpoint. And I put like drug and pharmaceutical companies in there. It's like there's a war for our attention, and that to me is like the baseline level of like what I'm trying to talk about is just like as a public policy, like societal level, like if we have any, maybe we should have a libertarian where we just don't do anything, but we're spending billions of trillions of dollars. It's just like we should be equipping people to like be well modulated, be feeding their bodies with good fuel, be like getting their energy out with movement, be sleeping. It's like we don't talk about any of that.
We don't talk about and also then, what about like financial literacy?
Well,
like you know what I mean?
Oh.
Like you said, it's all connected, but it's like everything that I feel like I should have learned when I was younger was not taught to me. That's how I feel.
Yeah, and in my, I went to Harvard Business School, and it's very passionate about this because I really, it was a great experience, met some great friends, met my wife, but it's just like, it's a conveyor belt of basically taking people. I see it kind of as this transition. So you have pretty, smart people ostensibly writing essays. Every single essay to get in is about changing the world. So I have a friend that wrote an essay about like going to Africa and helping like with healthcare inequity. And then you get in, and then 85% at the end of the treadmill, and this is just a microcosm, but I think this happens with like almost like every educational institution. It takes idealism, people with dreams, and then it kind of like molds you through peer pressure and just the centrifugal force. 85% of people go to traditional industries. So 85% of people are going to pharma companies, consulting, finance. Really, truly, and I think institutional distrust is rising for good reason. Industries that are not helping society right now and really need to have some outside thinking. But it takes everyone who writes about their dreams to change the world and then puts them. And then they did a study, Harvard professor, of a bunch of different cohorts, socioeconomic groups of people, and the highest rate of clinical depression of any cohort, lower income people, like everything, blue collar, the highest rate of clinical depression was among HBS graduates 10 years out. Because they were like had all these dreams, and then inevitably I got the mortgage. I'm like helping the man and just not doing anything and probably hurting society. And that is like what's happening. I think at like med schools, like it's happening at all of our elite institutions. And I see that. That friend that wrote the essay about changing the world went to work for McKinsey and worked on the account that helped whitewash the opioid stuff, and now they settled a big lawsuit. They were working on that. So it's just like that's happening en masse, like food companies, pharma companies. So it's like, there's just this centrifugal force. I was really scared. I was on that treadmill and like trying to get the credentials. And I don't know. It's gratifying. I think it's less scary to be outside the system than I think many people expect. I mean, everyone has to be on their own journey. But yeah, I think just the way we structure these academic institutions, I mean, it inevitably is tied to the same incentives of kind of creating people that are customers. There's nobody designing that, but it really is designed for people not to ask questions,
which is dangerous.
Yeah. Even at the top institution, it's just like it's almost like this like hamster wheel of like cogs going into the machine, and almost like peer pressure not to ask questions. So.
Yeah, I have a young cousin who's at Georgetown right now, and we talked for like an hour yesterday, and he's like, when I got there, I started realizing that like some of my professors, like, I don't really know if they're equipped to be teaching me this stuff, and it made me question the way things are, and all of that. And I mean, people are starting to realize. I think you're right. People are starting to wake up because this is a 21-year-old young kid telling me this.
Are you optimistic about the youth from what you said? I don't know. I go back because it's.
But here's the thing, though. I also know a lot of young kids who. It's funny. Is a 21-year-old a young kid?
Yeah.
But yeah, I know a lot of young kids who have dropped out of college and are realizing, what? Maybe I can forge my own path, because there are a lot of people who are much more successful than college graduates in terms of like financial success, much more successful because they had the street smarts to figure something out, or they were successful in business or something, or they became entertainers. I mean, there are a lot of people out there who have dropped out of college who are astronomically more successful than people who went to Harvard and Stanford and stuff like that. Like I've seen that too.
And my company hired this intern who's a high school junior, and she goes to this experimental school in Austin where they don't have teachers, and it's like,
what do they have, AI?
Well, they have, so they actually have some really smart facilitators who just are Socratic and kind of ask questions and provide resources. Then 2 hours a day, they're actually, this sounds potentially Orwellian, like sounds a little like post-apocalyptic, but it's pretty cool. They're at an AI computer program for 2 hours a day that's hyper personalized to them. So if like they're doing a math question, then in high school they'll ask like third grade geometry, and if they're not good on that, they'll go back, and they'll just constantly learn. And they don't optimize for this, but they do like 1550, like a highest score on the SAT on average, because it's just hyper learning and personalized to them. Then the rest of the day, they're able to just explore their passion, just unbridled.
Wow.
And this woman, girl, was tweeting about health, and Huberman was retweeting her, and like she had a ton.
No.
And my co-founder and I were following her, and had no idea she was a high schooler. The most profound, deep insights, first principle thinking, heavy research, and we both independently. She was blowing up so much on Twitter. We're like, she's an awesome. And then she's a high school junior. It's like if you can train kids first principle thinking, if you can like train them, it's like crazy stuff can happen. And now with AI, it's like, I hate to say it, but the expertise is like waning a little bit. You know, I would even say for fields you wouldn't expect, like I will not want to get surgery from a human. I don't think in 10 years. I would much rather have something that's seen a million different cases, of the human body. I think this is actually a war coming in the next, 10 years, because I think we'll be at a point where it's really going to be negligence to consult a lawyer that's a human, or I would actually say very highly refined. Like you can feed in images. They're working on this, on pictures of literally like surgery, like versus one person's experience versus like somebody that has like an AI that has data on a million bodies. So I think there's going to be huge resistance to that. But I don't know. I just think first principle thinking, questioning a little bit, kind of what's happening in some of these forms. I think it's positive. This one school, Alpha School, and this girl Grace is a great example. And she's doing better work on social media and content and like high level communication.
Wait, what's her full name?
Grace Price.
Grace Price. Okay.
Yeah. But I'm just astounded. So it's a little bit of hope there. But like that's like one school in Austin that a tech billionaire like made it his life's mission, personally developed the software.
Yeah.
I think Elon is involved. So it's like this one little beacon, but it's like, geez, oh my gosh, what if like the economy and the world is not zero sum? Like if we had that thinking for kids in mass, I'm like, oh my God, like
insane.
What the hell like would be happening to this world?
Well, I like that. That makes me very hopeful.
Yeah.
You know?
There's little pockets.
Yeah, there's definitely little pockets. Yeah. Okay. I have a question that I ask everybody who comes on this podcast. Because obviously we all have so many messages that we want to share with the world, but it's kind of hard to decide which is the most important to us or which we feel like most urgently needs to be shared. So I came up with this scenario. Are you ready?
Mm-hmm.
Okay. So you're at the Oscars and you're nominated for Best Documentary. It's a documentary about health and food and all that, and big pharma, how they're all interconnected. And after they call out the nominees, they call out the winner, and it's you. Mm-hmm. And you go up to the stage and you thank everybody you need to thank, your wife, your sister, your kid. Maybe you'll have two by then.
Yeah.
And then after you're done thanking everybody, there's about a 45-second to 1 minute window where you can say whatever you want. There will be headlines. It'll be on Instagram Reels, TikTok, everywhere. It'll be shared millions and millions of times, and it'll be on YouTube indefinitely as well. And, you're going to have millions of views there too. What is your message to the world? What are you going to say in that time span? Or what is so important to you? What message is so important to you? Out of everything that you think about and everything that you share, what do you put at the top?
Well, I talk about my mom. My mom was the greatest person I knew and our best friend, and she was a standard patient. I was born at 12 pounds. They said that was great. That was a sign of metabolic dysfunction. A couple years later, she had high blood sugar, was given a pill. Oh, it's fine. Everyone has that. A couple years later, had blood pressure, given a pill. A couple years later, high cholesterol, given a pill. So throughout my entire life, she was seen as very healthy. But by the time I was older, 6 medications. And then she was, I think I might have mentioned, taking a walk with my dad in 2021, not too long ago. Perfectly healthy 71, had a pain in her stomach. And then went to the doctor for a scan and had stage 4 pancreatic cancer. And going to Stanford, they told us that this was random, this was very unfortunate, this was very unlucky. Every single one of those things, right, throughout her entire life was a warning sign, a path for curiosity of what would absolutely have prevented this life-threatening thing. And we rallied beside her side, and I would say those 12 days was the most impactful of my life. I don't think the goal is to live forever, and it was actually the most life-affirming time of my life, watching my mom in her final days embrace this and surrounded by hundreds of cards that were sent in of how she impacted people's lives, and reading those. And it made me think about how time actually is, we don't even think about it, right? The fact that she had such an impact on other people, really made the time on this earth not really even matter. And then her final day of consciousness, she asked to go out to the ocean with my dad, and literally in her last breath before she went unconscious, the ocean hugged my dad and was like, this is beautiful, this is awesome. And she gave us that gift and showed us how to live life. But obviously 12 days from the diagnosis, she died. But I think about that, and I try to carry her energy forward, and I actually do not feel sad from her death. I feel really empowered. But I think this is the biggest kind of problem that we have, is things are connected. Every step along the way, every person dealing with PCOS, dealing with cancer, dealing with lesser things like depression or PCOS or a high biomarker, these are all clues. They're clues to be healthier down the road. They're clues to be happier and more present and more highly functioning today. And we just, this siloing is letting everyone down. And I just, that's kind of the mission that embedded in me and my sister, watching this experience with my mom, really hardened by how she lived life, but really trying to, I think, correct this mistake that we have, that things are siloed. Everything is connected. If you're having issues today, that will probably short your life. That will lead to things down the road. So I just think we need to understand the interconnectivity of everything, and that's kind of my story and kind of how I really, in 2021, really decided to devote my life to this issue.
Wow. Well,
Yeah.
I think you're going to change the world.
Thank you.
So
Thank
you for coming
that was
on.
Maybe longer than 45 seconds, but thank you.
It was. They would have played the music over it.
Thank you. And you are too.
Thank you. Thanks for coming on.